You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Thoryn Stephens. He's a scientist. He's working on adaptive AI to model and hopefully emulate human behavior. He's also a data visionary, keynote speaker, pioneering space for adaptive AI, human behavior, and biology intersect. He's the founder and CEO of BRAIN.ONE. So we're going to talk about what he's doing in the world of AI, and it promises to be very interesting. So Thoryn, welcome.
Hi, it's so great to meet you and happy to be here.
Yeah. Well, tell me, have you been around in the AI world for many years, and now it's kind of a new thing for you that you're heavily engaged in, or have you been working in the trenches for a long time and now things seem to be coming together?
That's a great question. So I began my career as a molecular biologist and focused in biotech and drug development. And this was in the 2000s, essentially, when I graduated college. We just sequenced the human genome. And at that time, we were doing bioinformatics. So it was really that intersection of biology with advanced computing. I really got into AI, I'd say probably like early, 2010-ish. And as I transitioned out of biotech into essentially data science, it was through that experience that I really began to, number one, have access to these massive data systems, and then began to dabble into machine learning, and had a number of mentors there that were very innovative and early in the space, including Dr. Galen Buckwalter. And Galen, they built, they were doing production level machine learning at a company called eHarmony, back in, 25 or so, 2005 in forward. So about 20, 30 years. But anyway, side note. So yeah, very much ingrained into kind of my worldview, and then definitely into my most recent research.
I have a question. Why all of a sudden, AI has been around for a long time, perceptrons, all kinds of different models. Why all of a sudden in 2023 was this a huge breakthrough in terms of ability? Like what do you think caused underlies it?
I think part of it is computational power, and honestly, just price has dropped so substantially. I mean, we were doing, when as I got into data science and I was doing more consumer research and testing and optimization, we were doing, production level AI, with Meta in brands like roughly 2015. So let's say 10 years ago. And I mean, even back then, it was still a bit clunky, relative to the models and the data management side of this. And it's just got so commoditized and really productized that it's, really part of our day to day, at this stage.
So you think the amount of computing power created this emergence of ability? Because LLMs, I mean, it's weird, they're essentially interpreting what would be said next in the conversation, but they seem to be intelligent, even though how could they?
Yep. Yeah. I mean, 100%. I mean, being in the trenches, for at least a decade or so, I mean, what we've seen is that, first and foremost, oftentimes when companies say they're using AI or machine learning, I mean, number one, that's not necessarily even true. There was that implosion of that big AI company about a year ago, where it turned out much of what they were doing was actually like rule-based, or worse, like, human level interaction to get the things done. So I think historically, it's actually been misused quite a bit. It maybe wasn't truly machine learning or AI, and again, a rule-based approach to solving a problem. But again, I think just, the technology has really gotten commoditized, easier to use, more consumer friendly, a lot of those pieces. And now it's pretty exciting. People ask me this pretty regularly. I think it's important for humans to embrace the technology and understand it, and then at least come from an informed position or opinion.
What other emergent properties are you expecting or postulating with even more computing power?
Yeah, just in general, or relative to health, or in what area?
Oh, from this point, like let's say computing power 10x. What do you expect that will be possible or emergent at that level?
Yeah, I can tell you what we're seeing. So we have a member of the team. His name's Dr. Galen Buckwalter. He's a chief brain futurist, and so he's really on the cutting edge and has been. I've known Galen for decades, and he is an AI scientist, behavioral scientist, and and his research just spans decades. And so in Galen's case, he's also a quadriplegic, and he has 6 neural implants called BCIs, or brain-computer interfaces. And he's in the middle of a clinical trial at Caltech. And so we will go to Caltech, and I've gone with him a few times, and he's sitting there, and essentially he has these 6 chips that are actually on his neural tissue, measuring down to a single neuron firing. Like, never in human history have we had this depth of brain resolution. And essentially what's happening is these arrays are measuring his electroactivity of his brain, and then it's using AI to then essentially allow him to control a robotic arm, is one of the immediate exercises, essentially. And so in that instance, right now we're seeing the intersection of biology and machine, and it's our generation. Literally right now, Galen is a pioneer there. And again, that's also, both on the ability to measure the brain, to excite the brain, and then also to drive AI to, allow you to control an artifact of the brain.
But again, like, let's say, I know you're not him, but just based on your experience, computing power like 100x, what do you think would be possible generically that is not possible now? What would you notice? What do you think could be done? Or 1,000x?
I mean, 1,000x, yeah. I mean, again, computational probability just goes through the roof. One of the most, I'm a biologist by training. Molecular biology and cell biology were my research for a number of years. And so where we're seeing that applied are areas like, protein folding. And so what could that do? Well, that advanced processing power of 1,000x could allow us to understand interactions on a protein, amino acid level that have never really been able to be modeled before. And so theoretically, that could also help us in the drug development cycle, to really understand if we have the right specificity of this molecule delivered, in this very particular way, it could, ultimately help curb a disease.
Okay. So what is BRAIN.ONE? Co-founder and CEO of it. What's the premise of the company? What does it do?
Yeah. So BRAIN.ONE, we are focused in the concept of, the mission first is to reach 1 billion humans and help them optimize their brain and their biology. And the vision of how we get there is through the idea of a hyper-personalized health protocol. And so what is a health protocol? So I come from the world of advanced, or I'd say endurance sports, and things like triathlon and Ironmans. And so in those worlds, you're following a protocol to achieve a goal, which could be, racing an Ironman as an example. And you're following a plan. And so a protocol basically is just a breakdown of a plan. It includes micro habits, and then it includes the non-negotiables in health. So things like nutrition, exercise, sleep, stress, connection. Those are some of the major pillars. And then it breaks it down into micro habits that, a human can follow to ultimately improve their health or well-being. And that's that's been the, really where we've come from. The genesis of the company. We started off in brain. And an example could be, dementia is preventable if you make certain lifestyle modifications. And there's a paper written called The Lancet 2024. We will take that paper, we will ingest it into our AI, develop editorial, and then ultimately a protocol that ideally our grandparents could follow, or our parents could follow, and ideally, again, reduce the possibility of getting dementia through these modifiable lifestyle changes. That's the premise.
Well, let's say you're running a marathon and you have this pump connected to you, and it's looking at the levels of 100 different biomarkers every second, and it senses that you're low in X, Y, and Z, and too high in A, B, and C, and it selectively releases cofactors or enzymes or whatever it may be to keep you in balance on a literal second by second or minute by minute rate. I wonder how much you can improve someone's run or performance. This isn't real short term instead of long term. What do you think something like that could do?
Oh, I think that's an awesome hypothesis, Richard. I'd love to test that. I mean, we're doing that now to a degree, but of course it's the feedback loops. It's not in real time yet, meaning, when I started doing triathlon 20 years ago, we had these big bulky Garmin watches, and they've only gotten better, and then, have additional biomarkers or biometrics, out of the box basically. And so now as we're training and, doing these types of races, you're getting feedback. The piece that's missing though is the real time optimization, to your point, oh, your carbohydrates are down, or, oh, you're, getting dehydrated, or you need to improve your electrolytes. So that level of feedback's not there yet, but, I think it could be coming. Another example that we're seeing pretty prevalent are things like continuous glucose monitoring, those devices, and tell you in real time what your glucose is looking at. That's a good example where you can immediately, ultimately titrate up or down, depending. But yeah, I mean, I think it's exciting. And what you're proposing, we're not quite there yet, but, I think we're moving in that direction. imagine.
Yeah, and I guess for the long term, again, it would do the same thing at a much lower sampling rate. But let's say you have a biological pathway where you can't process B vitamins unless they're in the methylated form. It would be tailored to you, and it could give you recommendations on the fly. And with your unique biology, I guess it would craft an ongoing changing plan for you based on what it's seeing, so that you could be really optimized quickly.
Yeah, so we've built parts of that now. It's not yet in real time, but the concept of adaptive AI. Are you familiar with that term?
I was going to ask you, because that's the main thing that you have in your bio. So what does that mean for listeners?
Yeah, so it's considered a type of artificial intelligence, and it continually learns and ultimately evolves in real time. And that's based on different data inputs. In our case, it could be biometric, it could be biomarkers, and then it could also be clinical assessments. And what that allows us to start to understand again is it's this composition of the human, and then further we can use that data to then adapt to their health protocol, to them at that moment in time based on their data. And so an example could be you wake up in the morning and we're agnostic to the wearable. We integrate into over 300, but let's say you have an Oura ring and your Oura ring shows, ultimately, Richard, your HRV is down. And you're like, okay, why is my HRV down? Well, I had a glass of wine last night and, that'll certainly do it. But then the adaptive part of this would be like, okay, your HRV is down 25%. You didn't sleep as well as you normally do. Normally, we would maybe recommend a micro habit like cold plunging, but, maybe since your parasympathetic is a little bit more taxed, why don't we recommend something like breath work? And so that's what we've built, again, an adaptive AI in the context of a health protocol. That's an integral part of the BRAIN.ONE solution. And I think there'll be, a very near point in the future where, again, people are utilizing, these tools to understand their health in real time, and then it's adapting to them based on their biology, ultimately.
Oh, that's really cool. I'm sure, the performance would be a lot better with that. I imagine, I was imagining like two MMA guys, and, what if you had a series of, I don't know, sensors so that you could see when one guy is going to punch you and you can counteract it. And, I guess you could probably do it on a microsecond or even faster level, and you could block any punch or kick, and it would just be really interesting to have something like that. I guess there's so many applications for this.
Yeah, 100%. And again, the one that's like, I would say out there in real time would be, the glucose example where, humans are managing their glucose in near real time. But yeah, this will absolutely expand to other areas of, one on the measurement side, different types of biomarker measurements, but then potentially, which you were alluding to earlier, the optimization of the biology, based on whatever the, upregulation, downregulation might be of that, particular gene or molecule, whatever it might be for that human at the time. So that's certainly the goal.
It'll be interesting if you tracked, a whole bunch of biomarkers, let's say on a, second by second basis, and you look at it over a month's time.
Yeah.
It would be interesting to see as these increase and these decrease, it would show patterns that you would never have seen before. Oh, I didn't know that these 7 seem to always respond in this way when these 3 change. And, what do they look like diurnally, or in response to stress, or in response to exercise? And yeah, there's so much learning, I guess, hidden in there we just can't see yet.
Oh, yeah. 100%. Yeah, we look at studies in a couple different ways. One is we can, have a study where we will look at biometrics, and then we'll give a human a protocol essentially of different types of lifestyle modifications and micro habits, so again, things like circadian regulation and direct sun in the morning and hydration and, cold plunging as an example. And then we have a measurement of, let's say their core biometrics over a time series. But what's also interesting is that we can also capture what are the other micro habits they're doing as part of their day to day. And so it actually fills in this bit of a void, relative to the other things that, to your point, could really impact their biology.
Yeah, what are some examples of micro habits? Like, how long is the habit? How many times?
Yeah, sure. Yeah, so when people ask me like, okay, well, what is a protocol? What's a micro habit? So the way we think about the world is the micro habit is the smallest action that really has compounded impact. It might seem small, and so a couple examples would be, if you're familiar with Andrew Huberman, the Stanford neurobiologist, we've analyzed every protocol on longevity ever written, or every every protocol that's ever been published, by Huberman as an example. And one of the number one things he evangelizes is the concept of circadian regulation and specifically getting direct sunlight in the morning. Are you familiar with that microhabit, Richard?
Well, I've heard it's good for you, but what do the studies show? What does it affect?
Yeah, I mean, so what's interesting is, again, this concept of the circadian clock, which essentially is a biological clock that helps jurisdict when you should be going to bed. And what's a little bit ironic is that that clock, it starts first thing in the morning, basically. So if you want to work on your sleep, which is in whatever 12 to 14 hours from the time you wake up, it actually starts with that moment that you wake up. And so getting direct sunlight in the morning, and it needs to be, I mean, ideally it's direct, no sunglasses, no filters, and so forth. But what that does is to essentially your nervous system, it helps regulate it such that you're, again, setting the, your circadian regulation for what will happen that evening. And so that's an example of a micro habit. 15 minutes in the morning, as soon as you wake up, as soon as you have direct sunlight, and just getting outside. You don't need to do anything. I mean, you could go on a walk, but that would be one very specific micro habit. And then you get into things like, duration and frequency. Another one could be cold plunging. I'm a big fan. I live here in Colorado. We go in the rivers, right now they're about -2 Celsius, and we'll go cold plunge. And so in the winters, what are the variables you're looking at? You're looking at the temperature of the water, which obviously you can't control, but you can control how long you're in the water for. And at that temperature, I can maybe do 90 seconds. It's literally below freezing, but it's moving. And then you also have things like frequency. So temperature, duration, frequency. And those are some of the variables that we tune within the microhabits. And the microhabits then form a protocol, which is just a structure, just a list of, task things to do. And then the protocols form a program. And a program usually is a time-bound, essentially objective, you're trying to reach. Like it could be mental health, it could be weight loss, it, could be anything under the sun, better sleep. But that's how we generally think of the world. With the microhabit is, the nucleus.
I think the big win will be when you do the microhabits for people. So like, let's say you sell a sleep mask and you know the different frequencies of, morning sunlight. And at a certain time, it's programmed to emit that light directly onto your closed eyes while you're sleeping, in the last 5 minutes before you wake up or something, and prepare you for the day so you don't have to go outside, not out of laziness, but just you don't have to do anything in order to accomplish that microhabit. Or, it is just the temperature of the room at certain times to optimize your sleep, or just does all kinds of stuff, like cools your bed down to 55.
Well, so
you lay the cold plunging.
Exactly. And they actually have that right now, Richard. Like, do you know the mattress Sleep 8? Have you seen that?
Well, I used to know the Uller, and then there was a few other ones. I guess the newest one's the 8, right?
Yeah. I mean, similar. It's circulating cold water, but to your point, and it's really about the feedback mechanism, and then how real time is that feedback. So, and I don't own a Sleep 8 yet. I pretty much own every wearable you can imagine, but I haven't bought one of these yet. But I have a friend that has one, and it's honestly pretty incredible, because my understanding is that it is self-regulating. So, if it feels temperature going up, I believe it will like cool the mattress, or a certain version will. And it's that idea of the, the feedback loop. Another example actually is there's a device called the Apollo Neuro. Have you ever seen that thing?
Oh, no.
It's essentially wearable. It's about the size of an Apple Watch. And I know Catherine and Dr. Dave Rabin, they're the co-founders. It came out of some of his research at University of Pittsburgh. But the concept is it's a vibrational device, and it supports parasympathetic nervous system. And as an example, what it will do is it will see if you are getting stressed. It will send a signal, and you have the device on, and the device automatically plays a frequency. And it's like just a vibrational frequency. They call it it's a vibrational song. But they've actually run a number of clinical trials, and they've seen really positive data around this. But that concept of vibration, again, helping, maybe, improve your heart rate variability or just your stress at that moment, as an example. So more of this stuff is becoming real, not quite down to like a biomarker or, delivery of a molecule, maybe outside of glucose, but, we're starting to see more and more of this every day. I think it's pretty exciting.
Yeah, no, that's really cool. So what's a way for people to keep tabs on all the innovations, that you recommend? What's a good central repository or place?
That's a good question. I mean, it's something we're building at BRAIN.ONE. We have a system for taking peer-reviewed articles and then summarizing them. And that's something that we have built in the platform. I'm a big fan of Huberman. I think he has done an incredible job for science and helping evangelize, 3 hours of content. I think a lot of the tools that he's talking about I think on the women's health side, there's a woman named Kayla Barnes. She's doing some really innovative stuff around women's longevity. Yeah, I mean, I think these are some of the people that are, on the kind of the cutting edge of the technology. And it's changing so quickly, on a nearly day-by-day basis. But very excited.
It would be interesting, too, if you took all of Huberman's podcasts, put them in, and then, had it suggest which topics he hasn't covered or barely covered, so you cover everything, or paste that against what's trending, et cetera.
Yeah.
And I'm sure that'd be useful to him.
Yeah, that's, is he following trends or leading them? I guess I would ask. I don't know, but he definitely seems, ahead of the trends on those things.
If you want to know about a certain condition and you could have, 100 of the top podcasts in that subject reviewed and all their content assessed to see who speaks about what, and then a summary report prepared for you, that would be pretty cool too.
Yeah, we could build that, Richard.
And it just takes a ton of data.
Yeah, that's very good. Though, to your, the first question, it's like we have more data and computational power than in, ever else in human history. So yeah, we could literally do that exercise, I think, fairly easily. It's a good idea.
Well, excellent. Well, Thoryn, thanks so much for coming. I appreciate it. I know you're doing quite a few podcasts, so I hope this one was a good one. And, thanks for your time.
No, great questions, Richard. I really appreciate it.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.